appendicitis are two conditions we often see here at Somerville Medical Center. Thank you for joining us today for this segment of Live Healthy. I'm your host, Lauren Collar, and today we're going to discuss these procedures with Dr. Sam Suter, a pediatric general surgeon here at Somerville Medical Center. Thanks for being here.
Thanks, Lauren. Yeah, so umbilical hernias are one of the most common things that we see in the office. Our patients are often sent to us by pediatricians. Something like 10, maybe even 20% of babies are born with a hole at their belly button that we all had in fetal life, but that's supposed to close up in the early days of life. But when it doesn't close up, it's called an umbilical hernia. Fortunately, most of those will close up during the first few years of life. But if one doesn't close up by the age of 5, or if it's symptomatic before that, causes pain or other problems between birth and 5, we'll fix those with a really quick elective operation. And that happens as day surgery. Patient comes into the hospital, goes to sleep for a few minutes, gets a quick operation, and goes home the same day. Other kids, though, have appendicitis, and of course that's a totally different thing, where children develop abdominal pain, and it goes through a certain pattern. We often evaluate them here at Somerville Medical Center or in our emergency department, or they come in from around the Low Country into our hospital. But those patients then get an emergency operation, which almost always, I mean virtually always, is laparoscopic. So we put a telescope in their belly button, 2 other telescopes down below their underwear line on one side, and take out the appendix in a 20-minute operation. And some of those kids can go home the same day.
What about recovery for both of these procedures?
It's actually remarkably similar. In fact, it may be easier to get over the laparoscopic appendectomy than it is to get over the umbilical hernia, particularly when a child has a large umbilical hernia. Not really sure why that should be, but the point is the recovery is quick, 2 or 3 days typically, and the kids are back at school or back in their normal routine.
All right. Thank you, Dr. Suter, for joining us.
You're welcome. Thanks for having me.
Thank you for being a part of Live Healthy.
Live Healthy is sponsored by Trident and Somerville Medical Centers and provided as a service to you and your family.